And welcome to this channel. My name is today Mr. Abbas Glory. So I welcome everybody here. If you are new, welcome here and kindly hit the notification button and subscribe so you'll be notified when other contents are dropped. So going straight to what we need to talk about, that's to do with delegation. We'll talk about delegations. So knowing what is delegation and the 5 rules of delegation, how to apply them is what will help us to be able to answer questions that has to do with delegation. So the first question then is, what is delegation? Now, delegation simply means the process for a nurse to direct other persons to perform nursing task or activity. Delegation simply means the process by which a nurse directs other persons to perform nursing task or nursing activities. That is delegation. Now, the big question then is, what are the 5 rules of delegations? 5 rights of delegation or 5 rules of delegation. Number one among them is you must have what we call the right task. The right task. What do you mean by the right task? Right task must be the task that must be appropriate to be delegated. This task appropriate for delegation? Can I delegate this task? That's the question you need to ask. Right task. Number 2, right circumstance. Now, this task I want to delegate, what is the condition for me to delegate? Is it suitable to be delegated? Now, for example, how do you know whether a task is suitable for delegation? You have to ask yourself the client's state of health. What's the status of the client? Is the patient stable or unstable? So those are factors you need to put in to know whether the right circumstances have been met for you to delegate it. Number 3, we have the right person. Now, when they say the right person, talking about the team members taking over the task, do they have the right certification? Do they have the right skill? Do they have the license? That is right person. This task I need to give out. The person I'm giving it out to, does the person have the required skill or the required license? Right person. Now, the next thing is right direction. Now, right direction simply means giving specific instruction needed to perform such a task. Right direction. Have I given the specific instruction for this task to be carried out? Right direction. Next is right supervision. Now, as a nurse, you must ensure that task was carried out appropriately. That is, you must be able to give out appropriate supervision. So you must ensure tasks were carried out appropriately. So that is the 5 rights of delegation. What are they again? The right task, the right circumstance, the right person, the right duration, and the right supervision. Now, the next question we need to now ask ourselves moving forward is, if we know all of these are the different rights of delegation, now who are we delegating to? Who are those we are delegating to? Of course, we have the unlicensed assistant personnel. Unlicensed assistant personnel. You might see UAP, unlicensed assistant personnel. The question is, what are the tasks we can delegate to them and what are the tasks we cannot delegate to them? Now, if you look at this picture, you're going to have yes, no, meaning these are tasks they can do. The no part of it are tasks they cannot carry out. What are they? Number 1, for yes, they can carry out ambulation. They can ambulate a patient. They can carry out turning, changing position. They can carry out bathing of the patient. They can carry out toileting of the patient. They can carry out oral care. They can carry out input and output chart. What have I said? The things they can carry out for the yes part of it, you're going to see they can do what we call ambulation or ambulating. They can do turning of the patient. They can change linen. They can do bathing of the patient. They can weigh the patient. They can do toileting for the patient, and they can also feed the patient. They can also do oral care for the patient. They can check vital sign for the patient. However, mind you, when we say vital sign, we are saying vital sign for continuous treatment. They cannot carry out first vital sign for a patient. First vital sign, they cannot carry it out. So, however, they can carry out subsequent vital sign in case of monitoring. Next, they can carry out intake and output. So the question is, what are the things they cannot do? What are the things they cannot do? Number one, they cannot give medication. They cannot give IVs. They cannot carry out assessment. Assessment of the patient, they cannot carry it out. So also they cannot carry out teaching of a patient. They cannot carry out first assessment. So also they cannot carry out teaching of the patient. Neither can they carry out teaching of discharge. So also they cannot delegate task. Let's take the first question. A nurse working in a busy long-term care facility needs to delegate to the unlicensed assistant personnel she is working with. Now, which of the following tasks would be appropriate to delegate? Select all that apply. I read the question again. A nurse working in a busy long-term care facility needs to delegate to the unlicensed assistant personnel she is working with. Which of the following tasks would be appropriate to delegate? What are the tasks again they delegate? Remember, I said the things they can do include ambulating, turning, bathing, toileting, oral care, vital sign, input and output chart. Now, the question is, which of these can be delegated? Looking at the option number one, perform an initial assessment. Can they carry out initial assessment? Let's hold on. Number two, check vital sign. Can they carry out vital sign? Let's hold on. Number three, which is C, setting up oxygen. Can they set up oxygen? Next, listen to client long sound. Can they listen to client long sound? Let's move on. Number E says administering acetaminophen for pain of 3. Now, what are the rules that guide them? We said, what are the things they cannot administer or the things they cannot do? They cannot give medication. They cannot give IV. They cannot carry out assessment. They cannot delegate. So if you look at this option, number one, perform an initial assessment. Can they carry out initial assessment? Of course not. That is out of the way. Number two, can they carry out vital sign? Yes, of course, they can carry out vital sign because it's part of their job. However, remember we say initial, they cannot carry out initial. So vital sign they can check so long it's continuous, but not first vital sign, which is assessment. 2 or 3, which is the C part of it, setting up oxygen. Can they set up oxygen? Now, setting up oxygen is a routine procedure that does not require too much information or require too much training. So long as a routine procedure, they can carry it out. So let's hold on to number C, setting up oxygen. Let's hold on to that. Next, listen to client long sound. Can they listen to client long sound? Of course not. It is not their responsibility to do that because it's out of their scope of practice. Next, administering acetaminophen for pain of 3. Now, remember the rule says administration medication is out of their scope. They cannot give medication. So the best option to this question is B and C. What is B? Checking vital sign. It is their responsibility. C says setting up oxygen. Yes, it is their responsibility. So the best option to the question is B and C. Now, after knowing this, let's move on to the next set of people called licensed practical nurse. Licensed practical nurse. Now, when you say licensed practical nurse, what are the things they are supposed to do? What are the things they are supposed to do, and what are the things they cannot do? Now, the first among them is, which means that the licensed practitioners can do everything unlicensed assistant personnel does, meaning everything the unlicensed personnel can do, this person can do them too. However, addition to what unlicensed practitioner nurse can, unlicensed assistant personnel does, or addition to them is number one, licensed practitioner nurse can be able to gather information, data gathering. They can do data gathering. Next, they can care for stable clients. They can care for stable clients. Next, they can do wound care. They can do wound care. They can administer medication. However, they can reinforce enforcement of teaching. That is to say, anything the nurse have done, the registered nurse have done, they can emphasize on them. They can explain, rather more or less like re-emphasizing the need to do it. Not necessarily mean teaching for that, but re-emphasizing the need to do it. For example, let's assume the nurse have taught the patient on the need to do oral care. They can come on the need to tell them the important why they should continue the oral care. Not coming to teach new things, but to reinforce what had been said. So, what are the things they can do again? Everything AUP can do, they can do them, including all of that. And I said, addition to that, gathering data, they can do that. Meaning they can do vital sign check, they can gather information, they can care for stable patient, they can do wound care, they can administer medication, they can reinforce teaching. However, these people are not allowed to administer, to do assessment, admission assessment. They cannot do admission assessment. Why? Every initial assessment must be done by the registered nurse. So admission assessment is out of their scope of practice. Next is planning. They cannot plan. Neither can they evaluate. However, they are not allowed to care for unstable patients. What have I said? The things they cannot do, they cannot carry out admission assessment, they cannot carry out admission assessment, they cannot carry out planning, they cannot carry out evaluation, so also they cannot care for unstable patient. Licensed practitioner nurse. If they cannot do all of these, the question is, let's now take the second question and know how we can relate it to them. The second question says, a registered nurse and a licensed practical nurse are working together in a psychiatric ward. A registered nurse and a licensed practical nurse are working together in a psychiatric ward. Which of the following clients may the registered nurse assign to the licensed practical nurse? I repeat the question. A registered nurse and a licensed practical nurse are working together in a psychiatric ward. Which of the following client may the registered nurse assign to the licensed practical nurse? A says a client taking amitriptyline, now swinging his jaw and grimacing, having grimacing. Now I repeat myself. A says a client taking amitriptyline, now swinging his jaw and grimacing. B, a client with dementia that is confused and disoriented. Now, C says a client with bipolar disorder and a lithium level of 2. C or D says a client with history of chronic alcoholism experiencing delirium tremors. The big question is, which of these patients can the registered nurse assign to licensed practical nurse? The first question we need to ask ourselves, what are the things that licensed practical nurse do again? What are the things they can do? We said everything around unlicensed assistant nurse does, they can do them. Addition to them is gathering data, caring for stable patient, wound care, medication, reinforcement. However, they cannot carry out nursing process, which is admission, assessment. They cannot carry out planning. They cannot carry out evaluation. They cannot care for unstable patient. Going to the first option, the client taking amitriptyline, now having swinging his jaw and grimacing. The first question is this patient stable? If they can attend to stable patient, is this patient stable? Of course not, this patient is not stable. It therefore means that this patient who is taking this medication require attention from the nurse. Why? Because the patient is having serious condition arising from taking antipsychotic medication. The patient is having serious condition arising from taking antipsychotic medication. Because of that, the nurse should handle the patient because the patient is unstable. Now, the big question, the big part of it says a client with dementia that is confused and disoriented. The patient with dementia that is confused and disoriented. The question is this patient stable or unstable? Is this patient stable or unstable? Now, the question is, if a patient will have a dementia, a client with dementia that is confused and disoriented, somebody who's having dementia, is it expected for the patient to be confused and disoriented? Yes, of course, it's expected. It therefore means that option 2, this patient who is experiencing dementia is stable. However, what he's experiencing is expected. So let's hold on to number 2, or which is the B part, while we look at others. Now, the C part of it says a client with bipolar disorder, a lithium level of 2. Now, the question is, a client with lithium level of 2 is having severe lithium toxicity. A patient with lithium level of 2 is having severe lithium toxicity. Now, this client should be taken care of by a registered nurse. Now, the question you got to ask yourself is, what is the safe level of lithium? Now, the safe level of lithium is between 0.6 to 1.2. The safe level of lithium in the blood is between 0.6 and 1.2. That is the safe level. However, somebody who's having 2.0 is a severe condition that the registered nurse need to attend to. So let's move on and let's look at the last one. A client with history of chronic alcoholism experiencing delirium tremors. Now, this question, is this patient to be delegated? Now, delirium tremor is a sign of severe alcoholism withdrawal. We should have that. So somebody having withdrawal is expected to have this. However, this is associated with onset of confusion, and sometimes the patient may be having seizure and all of that. So this patient is unstable. So because of the fact that he's unstable, the nurse needs to be the one to attend to him, because he may come up with unstable behavior and all of that. So the best option that should be delegated at this point is option 2, which is B, the client with dementia that is confused and disoriented. That is the best option the nurse can delegate to the nurse. So using that same method, let's now attend to the last question which we have. The nurse and licensed practical nurse are working in a busy shift at a pediatric ward. The nurse, to provide efficiency in the ward, should delegate which task to the licensed practical nurse? Number 1, administration of medication in syrup form to an infant with cleft palate. 2, provide discharge instruction to the mother of a child with epiglottitis. Next, changing of colostomy bag to a toddler with anus atresia. Now, next, assisting a child developmental level, assisting a child's developmental level. The big question is, which of these can the nurse delegate? Following our rule that says for delegation to occur, everything about nursing process should not be carried out. What are they? Assessment, admission, planning, evaluation, and unstable patient. They can gather information, can care for stable patient, they can care for stable patient, they can do wound care, they can administer medication, reinforcement. However, the question then is, which of them is unstable? Which of them can the licensed practical nurse not do? Number 1, administration of medication in syrup to an infant with cleft palate. This is not an infant with a normal mouth. So is it safe for a licensed practical nurse to administer medication to a patient with cleft palate? Of course not, because it is not safe. Why? Is a special child that is a condition that requires special monitoring. So number 1 is out of it. Let's move on. Providing discharge instruction to a mother of a child with epiglottitis. Remember we said a part of the things they cannot do is discharge. They cannot carry out discharge. So discharge teaching they cannot carry out because it's part of evaluation and all of that. They cannot do it. So that is out of the way. C, changing of colostomy bag to a toddler with anal atresia. Changing of colostomy bag. Changing of colostomy bag. Is that their role? Yes, they can do that. Because remember we said wound dressing, they can carry out wound dressing, they can carry out reinforcement, all that. So wound dressing and all of that is also it falls under their job. But let's hold on to that and we move to the next one. Now, assess a child developmental level? Can they assess a child developmental level? Of course not. That is not their job because it's out of their scope of practice. So the best option at this point is changing of colostomy bar to a toddler with anatrasia. So that is the best option. Now, before we move on to attempt question you might want to attempt on your own, what is the responsibility of the registered nurse? What is the responsibility of a registered nurse? Number one, they can carry out assessment, they can carry out evaluation, they can carry out teaching, they can carry out education, they can carry out care plan, they can care for stable patient. Meaning everything that we know in regard to nursing process, a registered nurse can carry them out. What are they? We said assessment, evaluation, teaching, educating, care plan. They can carry out the care plan. They can also care for unstable patient. Now, after knowing all of these, I want you to look at this last question. Look at it critically and analyze them. Drop your answer in the comment section. Let's see who gets them. At the end of the day, following the rules we talked about, the 5 rules of delegation, look at the question, drop your answer in the comment section. Never forget to share, like, and comment. Thank you.